We had Winston. Winston was one of the first dogs. He was a pug. And when I went out to visit, it was just so heartwarming. Sometimes, you come in with a dog and they'll pet a little bit, but then they tell their stories. And so the dog might just kind of lay down or sit in the patient's lap, but then it's the opportunity for that patient to tell you their story.
The program that we have with pet therapy, we have a variety of volunteers that actually come in with their dogs, and they come into the hospital and they spend time with our patients, visitors, and the staff members that we have here at the hospital.
So when we first started out, we thought we would be going to visit patients, hospice patients in their home. We thought that's what we would be doing. And it ended up, we did do some of that, but it ended up blossoming into here at the hospital, and also we go to 18 area nursing home and assisted living facilities.
To see the reaction of a lot of the residents when we would walk into, especially like memory care, assisted living, they would be so joyful to see the dogs, and they always had stories to tell.
They reiterate how important that the pets are and how they really kind of lessen the anxiety and really make it more of a normalcy.
Well, I started thinking about this when I was planning my retirement. I've been a psychiatrist at the Marshfield Clinic for many years, and I saw this as an opportunity to do therapy without having to bill or write notes, and to continue my interest in people. That interaction, that opportunity to play, that invitation, they invite you to play, and we all need that. And so I think it's that unconditional acceptance and their willingness to meet you where you are. All too often, all we have available to us is sedation and medication when people are upset or agitated, and there are other avenues that you can use that are more therapeutic and less harmful than medication. Animals are one of them, music, art, where these kinds of interventions were very powerful, and it increases the modalities that we have available to us in our toolbox to be able to help people who are stuck in a hospital.
Tammy and I happened to be walking down the hall with Angie one day, and a young woman came up to us and said, "May I pet your dog?" And I said, "Of course. That's why we're here." And she knelt down on the floor and threw her arms around Angie and just started sobbing into her neck. And Angie just sat there. Then she eventually started pulling away, and as she did, Angie licked a tear off her face. It was so touching, and the gal said, "That's just what I needed." This is what these dogs can do. They seem to understand and to know what is needed and to give that love and compassion so much better than we can.